the surgery. Actually, one of the techniques that we use, Yao 2K technique, was introduced by one of our professors, Prof. Kwakume, and is used worldwide, where you tie a tourniquet and then you do the myomectomy so that the woman doesn't bleed a lot. Okay. It's a technique that the Ghanaian developed, and we are all using it. Okay. So that's why in preparation for the surgery, we'll always ask you to donate blood. It's like insurance. We'll always make sure we have blood standby for the surgery. It's standard procedure. Most of the time, we'll not use the blood because we use the techniques to minimize the blood loss. But in some cases, we give the blood because then the woman's blood, she's lost a lot of blood during the procedure and the blood level is down. And then we don't want her to dip down, so we give her the blood. So by and large, the most common complication is bleeding. Sometimes, in rare occasions, people can have infection of the uterus where there may be some necrosis and all that happening there, and they may have to have a hysterectomy in the end because of that. But that is not very common. I mean, I don't remember seeing one, but it can happen, but it's not a very common complication. The commonest complication is bleeding. Okay. And to prevent that, we usually will ask you to donate at least 2 units of blood standby, and then where we have other things that we also add to make sure that we minimize the bleeding and then you don't bleed a lot.
After delivery, they will be fine. If they have normal vaginal delivery, they will be fine. Or do you plan to take them out later?
So when you are pregnant and you have fibroids, they undergo a certain change called degeneration. There are some changes that occur in the fibroids when you are pregnant, and they can cause severe pain. So when I have a client who has fibroids and she gets pregnant, I tell her, this is the battle that we are going to fight. You are pregnant, thanks be to God, but the fibroids who are there, they will grow big as the pregnancy is also growing. And sometimes they will cause you pain most of the time, but some of them, surprisingly, some of them too, they don't cause them any pain. They don't even realize that the fibroids are there. Okay. But usually it is pain that you have when the fibroids coexist with pregnancy. You have pain, so that I tell them, and then they are aware of what will happen, so that if it happens, they are not alarmed. And then we give them certain medications in readiness for what might happen, so that we manage the pregnancy together, so that she knows that, yes, this pain will come, and it's because of the fibroids, because of this and that and that. And then have pain, there's pain. And because the fibroids undergo a change you call degeneration. Yeah. So we let the woman know that it's a battle that we are going to fight, but we are in it together. Some of them may not have the pain, but some may have it, most of them will. So that we give you medications and things to manage the pain till we get to term. Okay. And then when we get to term, based on where the fibroids are, if they are blocking the mouth of the womb, we may have to do a cesarean section to take the baby out, because there's no way that baby can come out because the fibroid is blocking the lower uterine segment. Okay. But if it's not blocking the lower uterine segment and it's somewhere, and then the lower segment is free, the baby can come. Okay. Do you understand? But if the one has also had a myomectomy already, like the fibroid surgery that we talk about, and she's pregnant, usually, depending on how extensive the surgery was, we recommend a cesarean section during the delivery, because we don't want the uterus to start contracting for a rupture to occur. Yeah. So we will advise for a cesarean section, and then we will take the baby out ourselves before contractions starting, as it happens in labor. So these are the main complications that will occur when you have fibroids in pregnancy.
Now, would you recommend that women or young ladies, before they get married or even at any age, go to screen for fibroid?
This question they ask about. So my answer to the question is that, so if you have fibroids, one of the reasons why you know you have fibroids is that it will worry you and you come to us. Yeah. So if it is not worrying you, then we assume that you don't have fibroids. That I hope you get my understanding. Yeah. So I wouldn't advise that they should routinely go checking whether they have fibroids or not. Okay. Because even if you go and check and you come and there's a small nodule there and it's not worrying you, we are not going to do anything about it. Yeah. If for some reason you have to do a scan and they pick it up yes, they will send them to us, and then we reassure them that yes, it's there. But because it's not causing any problems, you're not doing anything about it. So I wouldn't recommend people going about doing scans to check whether they have fibroids or not. It won't make any difference if it's not symptomatic. So in conclusion, I would want to say that fibroids, as I said earlier, is the commonest condition that we see in our women. And they should come to the hospital that we see in our hospital. We will discuss with them and then find out whether they are symptomatic or not, whether they need to have surgery done, whatever treatment that are available for them. But they shouldn't go about drinking all sorts of herbs that end up affecting their kidneys and other organs and doing all sorts of things before they come to us in the end. The definitive management of fibroids is surgery. So fibroid now, surgery not ultimate. And you come and see us, Albra. We'll have a discussion and then we'll tailor the best treatment option that you have. That is not what we recommend. And our doors are opened. Come, we'll sit down with you, find out exactly what it is, whether it's symptomatic or not, as I've already talked about. And then you'll be sorted out. And at the end of the day, you are happy, and then we are also happy. So I hope that from now onwards, our sisters and our mothers would come to us when they have such issues and not go about taking other medicines in the say that they are going to melt fibroids and all of that. That's a fallacy. There is no drug that melts fibroids. We thank you very much.
Ladies and gentlemen, I hope today you have learned a lot. There are so many questions that I'm sure you have had answers to about fibroids. My guest for today was Dr. James Boakye, an obstetrician gynecologist at the Lekma Hospital. If you have any question, please send me a WhatsApp message on 059 242 0625. 059 242 0625. Thank you very much, Doc, for your time and for explaining to us all about fibroid. Ladies and gentlemen, have a nice evening. Bye.
Pregnancy should be a time of joy and not anxiety for the woman and her family. Do you want to learn more about pregnancy or have questions about fertility and reproductive health? Then join Dr. Linda Vanuatu on Facebook and YouTube every Saturday at 4 p.m. on the online pregnancy school as she discusses pregnancy, delivery, and childcare.